Frontline policing in Ontario continues to evolve from the day-to-day reality we would recognize in decades gone by. New public safety issues are emerging, and these require new responses. Each day, police officers across Ontario are called on to assist vulnerable people in situations of acute crisis. It is now commonplace for police to respond to thousands of mental health and addictions related calls every year. And these can, of course, be very complex and sensitive situations. While police officers are often the first emergency responders to be called to intervene, a traditional enforcement response is not always the most appropriate approach. Responding to persons in crisis-related calls requires a special combination of skills and expertise. That is why I am proud to announce that as part of the 2021 budget, our government is investing $8.4 million over 3 years in a new OPP crisis call diversion program. Designed to help police improve the way they respond to crisis calls, the program consists of a professional mental health and addictions crisis worker who will be embedded in each of the OPP communication centers. The program, which was first piloted at the OPP Communication Centre in London, is now up and running in Thunder Bay, with more locations across Ontario coming on board later this year. This program will help police officers provide the most appropriate response to calls from individuals experiencing mental health or addictions crisis, which may include diversion to mental health services in the community. Our government is proud to take real, concrete action to enhance care for mental health and other acute crisis situations. Dedicated mental health and addiction specialists will ensure individuals experiencing a crisis can access immediate supports while diverting the need for police interventions in non-emergency situations. Our government acknowledges the important reality that mental health is health, and we believe every Ontarian should be able to count on appropriate care and the supports they need. Thank you.
Thank you, Minister. I'll now call upon the Honourable Peter Bethlenfalvy, Minister of Finance.
Well, thank you, Stephen, and good morning, everyone. It's a pleasure to be here virtually with you today. And I want to begin by saying a really big thank you to all of Ontario's frontline heroes, including the OPP, for your resolve and dedication. You continue to report for duty each day despite numerous dangers, including, of course, the pandemic. So I say thank you for your ongoing service. As Minister Jones just announced, the 2021 budget is committing $8.4 million over 3 years for a new OPP crisis call diversion program. This program will see mental health workers embedded in OPP communication centers to help provincial police better manage mental health and addictions crisis calls. This will offer immediate support to individuals in crisis so they can get the support they need. Le budget de 2021 comporte un engagement d'investir 8,4 millions de dollars sur 3 ans dans un nouveau programme de renvoi des appels de crise de la police provinciale de l'Ontario. Grâce au programme, les travailleurs et travailleuses en santé mentale s'intégreront au centre de communication de l'OPP pour aider la police provinciale à mieux gérer les appels relatifs aux crises liées aux problèmes de santé mentale et de dépendance. Ce programme offrira un soutien immédiat aux personnes en situation de crise afin qu'elles reçoivent l'aide dont elles ont besoin. In putting together this year's budget, we knew it was critical to focus resources on our pandemic response and recovery. That's why protecting people's health is such an important focus of our budget. It also drives our commitment to mental health and addictions treatment and care, because I truly believe that mental health is health. Our budget also includes $12.5 million over 3 years to enhance the mental health services available to OPP staff, to create a healthier, more supportive work environment for OPP officers and civilian staff. While the OPP look out for the people of Ontario, they can count on their government to look out for them. We have a lot of work left to do, and COVID-19 has only intensified the need for action. To ensure that people experiencing mental health and addictions challenges have access to the treatment and care they need, our government is making record investments, including the Roadmap to Wellness, a $3.8 billion 10-year commitment to mental health and addictions funding, and an additional $175 million in the 2021 budget to provide more and better care for everyone who needs it. Our government's number one priority continues to be protecting people's health and supporting Ontario's economic recovery. Whether that's our $1 billion province-wide vaccination plan, the $1.4 billion for PPE to protect our frontline heroes and vulnerable people, or the additional $5.1 billion we've invested to support hospitals since the pandemic began. As I always say, you can't have a healthy economy without healthy people, and this includes mental health now more than ever. Thank you again to all our frontline heroes, our doctors, our nurses, our healthcare workers, our personal support workers, and the men and women of the OPP for doing your part to keep all of us safe. Enormous sacrifices have been made by individuals, families, and communities across Ontario for over a year now. But as the vaccine rollout continues to accelerate across Ontario, hope is just on the horizon. Thank you, and I'll turn it back to Stephen.
Thank you, Minister Bethlenfalvy. I'll now call on Thomas Carrique, Commissioner of the Ontario Provincial Police.
Ministers, good morning all. I would like to begin by acknowledging that we are all on lands traditionally occupied by Indigenous peoples. They continue to care for this land. They continue to shape Ontario today, for which I would like to express my sincere gratitude and respect. On behalf of the Ontario Provincial Police, thank you for joining us for this incredibly important announcement. As we know, police are often the default emergency response for mental health issues, but are not always the best suited to address these complex health matters. The OPP has partnered with mental health and addiction practitioners in order to develop, improve, expand, and enhance programs to support persons in crisis. The funding and support from the province will provide the OPP with resources to continue implementing and to maintain the new crisis call diversion program. The program places crisis workers in OPP communication centers to work alongside communications operators, and if appropriate and when required, will de-escalate and support persons in crisis, divert non-emergent mental health calls away from police and towards other appropriate service providers, reduce the use of police resources for non-emergent responses, and help individuals in crisis by offering better pathways to meet their health needs. These crisis workers will assist callers and be able to provide individuals with supportive interventions, connections to community services, education on pathways to care when they're in crisis, and ways to reduce future police interaction. With the support of the province, the initial pilot of the Crisis Call Diversion Program commenced in our Ontario London's Communication Centre on November the 2nd, 2020, resulting in embedded crisis workers being engaged in 421 calls for service. 63 of these calls were diverted away from a frontline police response. In addition, 409 referrals and/or follow-ups have been completed by the Canadian Mental Health Association. On May the 3rd, 2021, the Crisis Call Diversion Program expanded to our Thunder Bay Communication Centre, resulted in embedded crisis workers being engaged in 57 calls for service, 15 of which were diverted from any frontline response or officer interaction. In addition, 68 referrals and/or follow-ups were completed by the Canadian Mental Health Association. With the support of the Ontario government investment over the next 3 years, the OPP Crisis Call Diversion Program will expand into our remaining provincial communication centers, resulting in enhanced capacity and capability to assess complex mental health calls for service and to assure that the most appropriate and effective services are provided when they are needed most. The OPP truly understands that mental health is health and that healthy communities are safer communities. The strong support and leadership from the province of Ontario for the OPP Crisis Call Diversion Program has enabled the OPP to equitably and compassionately modernize our service delivery model while maintaining our tireless commitment to ensuring safe communities and a secure Ontario. Thank you. Merci. Miigwech.
Thank you, Commissioner Carrique. We'll now turn things over to the Honorable Michael Tibollo, Associate Minister for Mental Health and Addictions.
Thank you, Stephen, and good morning, everyone. It's truly an honor and a pleasure to be here today and be part of this announcement. I also want to start by giving a special thank you to Commissioner Carrique and the OPP for the tremendous work in keeping us safe. When you think about the work that our first responders do and our frontline workers, where would we be if it wasn't for their dedication and their hard work? I always say that their work is really a vocation. It's not a job. And each one of them demonstrates that every single day when they get to work and do the things that they do to keep us safe. You know, protecting the health and well-being of Ontarians is our government's top priority, and that includes mental health. Ontarians have faced unprecedented challenges during the COVID-19 pandemic, including to their mental health. And that's why our government acted quickly, investing an additional $194 million to immediately make it easier for people to get the mental health and addiction services they need. Last year, our government launched Roadmap to Wellness, an action-oriented plan to build a comprehensive, connected, and integrated system of mental health and addiction services that works for all Ontarians. Our plan reflects the priorities we heard again and again through consultations with frontline mental health and addictions workers, experts, advocates, first responders, and individuals with lived experiences and their families. Under the Roadmap to Wellness and included in the 2021 budget, our government invested an additional $175 million this year to fill the urgent gaps in care and provide more mental health and addictions treatment services. This is an increase of $525 million in annualized funding for mental health and addiction support since 2019-2020. Through our plan, we've been working collaboratively across all sectors to ensure that all Ontarians are matched with the most appropriate mental health and addiction supports that meet their unique needs. Last year, our government invested over $37 million to significantly expand mental health services across the justice sector. These services support the challenging work being done by the many brave men and women of Ontario's law enforcement services every single day. This included over $6.5 million to expand or launch the integrated mobile crisis response services in 33 communities across the province, which partner with police to de-escalate persons in a mental health and addictions crisis. Mobile crisis teams are a significant tool to support police officers as they work to de-escalate high-pressure and complex situations. Our government is committed to supporting our police officers in the important work they're doing, and most importantly, ensuring we are supporting people who are in crisis. Through today's investment, Ontarians who may be experiencing a mental health or addictions crisis will be further supported to get the care they need when and where they need it. And we all agree that mental health is health. Thank you. Miigwech, merci.
Thank you, Minister Tibollo. I'll now invite media attendees to virtually raise your hand to indicate that you have a question. It'll be one question and one follow-up. And again, please indicate to whom you're asking your question so the correct speaker knows to unmute. We'll go to questions now, and our first question is from Colin DeMello. Oh, sorry, Colin. Please go ahead.
Can you hear me now?
Yep.
Perfect. My question is for the Solicitor General. Ms. Jones, it's been 10 days, rather, there are 10 days left until step 2. We've not only met, but actually exceeded our vaccination targets, not just for step 2, but for step 3. I'm just wondering what your argument is for keeping the province locked down.
Thanks for the question, Colin. You know, what Ontario has done very successfully is in a measured way ensured that we have allowed and had access to individuals receiving their first and second dose vaccine On the other hand, we have also seen some hotspots like Waterloo, like the Porcupine Public Health Unit. So under the direction of the Health Table and Dr. Williams, we have been very carefully monitoring and closely following not just the vaccination rates, not just the positivity rates, but all of the other factors that play into whether we can safely reopen. And that includes things like our hospital capacity, because the last thing we want is to have to once again ask for assistance from other provinces, very similar to what we're doing right now, where we have 11 Manitoba residents in our ICU beds because they need help. So we're doing this in a very measured way under the advice and guidance of our Health Table and the Chief Medical Officer of Health.
Follow up.
Thank you. And my next question is actually for the finance minister. Minister, as you know, a lot of businesses say that it's going to take a long time for them to actually get back to, making the kind of money they were before the pandemic. So I'm wondering if your government actually has a strategy in place to speed up the third step of the reopening plan and to perhaps give those businesses some financial incentives to help them as they slowly kind of, get to the capacity that was pre-pandemic.
Yeah, that's a very good point, Colin. So many businesses have struggled because of the lockdown, and many of our small businesses, they're the backbone of the Ontario economy, and they're the identity often of our communities. So that's why we put in place unprecedented supports to bridge them to recovery, not least of which is the Ontario Small Business Grants, over $3 billion, the tourism and travel grant that we recently announced, the property tax and electricity that we've continued to fund for those affected by the lockdown. Well, let me tell you, the future does look bright. Many economists have come out and expected Ontario to grow by about 5.4% this year. The US is growing stronger. And I think the best stimulus for our businesses, is to reopen safely. As Sylvia just said, we are on a path to reopen. We've been clear about the metrics and the path forward. But we have to do it safely. And once we do, that's the best medicine for our businesses, and we'll be there to support them. And, we'll all continue to support our local businesses, buy local, and continue to support them even after we beat this pandemic. Thank you.
Our next question is from Laura Stone with the Globe and Mail. Please go ahead.
Hi there. My question's for Minister Jones. Can you hear me, Minister?
I can.
Okay, great. I just wanted to know, we spoke last week about Moderna and Pfizer and the interchangeability, and you're telling people to take either. Has the province encountered now any resistance with people who've received Pfizer for their first dose and are being offered Moderna and are turning it down or walking away? Do you have any sense or statistics as to how much or whether this is happening?
Great question, Laura. No statistics. We were hearing anecdotally from the public health units when Minister Elliott and I meet with them twice a week, some feedback on concerns about whether it was appropriate or needed to switch the messenger RNA vaccines. To date, it has been very small. I have to give a big shout out to many of the medical experts, the doctors, the scientists who have reinforced what the National Advisory Council on Immunizations has told us, which is that the messenger RNAs vaccines are essentially interchangeable. So when that message gets out and when people understand that they are essentially the same type of vaccine, and please, the first one that you can receive, take. The other piece that's really important is in Canada right now, Health Canada has only approved the Pfizer vaccine for our adolescent 12 to 17-year-olds. So, there is also a piece that says, please allow our public health units to use the Pfizer vaccine on our 12 to 17-year-olds so that we can continue to safely vaccinate the young people. And as I said, the first vaccine that you are offered, please take it because it will give you the coverage you need.
Follow up.
Okay, thank you. And just on the topic of the border, are you able to comment on the federal government's plan announced yesterday about fully vaccinated Canadians and permanent residents being welcomed back in after January 5th without quarantine requirements. What do you think of that plan, and what do you make of the fact that their children would still have to quarantine, and what do you make of the fact that there's basically no plan set out after that, or any guidance for beyond that date for what will happen with the Canada-US border?
So just for clarity, the children who have not yet received a vaccine would be quarantining with their family in their family residence. So this isn't a case of separating children from parents. Look, I think that there were a lot of people who, because they have received both doses, are anxious to reconnect with friends and family who live in the United States. So I think it's important that the federal government has given clarity on that. I will say, and I don't want to sound like a broken record, but there are still a number of American jurisdictions that have, frankly, very low vaccine rates. And that does concern me, because even when you are fully protected, you still have the ability to carry that Delta variant back to your home and your community. So we'll continue to have those conversations with the federal government. The one thing that Minister Elliott and I are very seized on is, of course, AstraZeneca has not been used or approved in the United States, but we want to make sure that individuals who received an AstraZeneca dose in Ontario or Canada are going to be offered the same rights to travel as anyone else who has a WHO-approved vaccine. Thanks, Laura.
Our next question's from Richard Southern with 680 News. Please go ahead.
Hi, good morning, everybody. For the Solicitor General, Ms. Jones, again, on step 2, we've reached the vaccination requirements. I've talked to a lot of the barbers and salons. They have a plan, they say, to open safely. And I think they deserve some notice here. So I want to ask you, is the cabinet looking at starting step 2 early or not?
So the cabinet and individual ministers, as well as the health table, are having ongoing daily conversations about where we're at in terms of vaccine rollout, where we're at in terms of positivity rates, where we're at in terms of how the Delta variant is or is not spreading throughout our communities. I can assure you that all of those conversations are very active and engaged. And look, I couldn't be happier if we could open sooner, but I also want to do it safely. And we're doing that under the advice and guidance of the Chief Medical Officer of Health and the Health Table. And as soon as we are able to share the news with businesses and the people of Ontario, we will do that. Thank you.
Thank you. Follow up for the Finance Minister, if I may. It looks, sir, like the Senate is set to pass third reading of this federal bill that would legalize single game wagering. I know the province has a lot of thoughts on that. I'm wondering if you can weigh in on how Ontario will deal with that, and also how much you're relying on that, sir, to tackle all the red ink that's on the books.
Yeah, thank you, Richard. By the way, I'm with Sylvia. I've got nothing's going on the top of my head for months and months, but I got a real party going on in the back. So I'm with Sylvia on all considerations under active discussion. With regard to single sports betting and really all of iGaming, Richard, that's something that I had tasked my parliamentary assistant, Stan Cho. And by the way, Stan Cho, congratulations. He's just been promoted to Associate Minister to the Minister of Transportation. But he's been navigating the gaming file. We are working with stakeholders and consulting broadly. We have an expert advisor in Birgit Sand from Denmark, who's also laid out the groundwork and a framework over in Europe. We want to have the best standard, frankly, that we can deliver here should that pass in the Senate. So we are in active consultation on how best to proceed.
Our next question is from Theodore Doucette from the Radio Canada. Please go ahead. Theodore? Oh, you're still muted. There you go.
Hi, good morning. Do you hear me?
Yep.
Yeah. My question is for the Solicitor General. Regarding the announcement of today, in how many PPO OPP communication centers will this program be implemented, and when?
Great question, and I'll turn some of the details over to Commissioner Carrique. But of course, we started with a pilot project late year in last year in London, Ontario, and our second one is operational in the Thunder Bay Communication Center. And I really want to enforce how important this is to people who are in crisis but don't need a police officer. So the ability to vert away and put individuals in front of community supports is critical. But in terms of the next comm centers moving forward, I'll turn that over to Commissioner Carrique. Thank you.
Thank you, Minister. As you've already indicated, we're already up and running in London and in Thunder Bay. Next will be Orillia, followed by North Bay, which will provide us coverage across the entire province for all OPP police jurisdictions.
Thank you. Follow up?
Yes, will this mental health assistance program be available in French and everywhere in Ontario?
Yes, they will be available in French. A certain percentage of our call takers are bilingual. We do have a vast majority of French-speaking call takers stationed in our North Bay Provincial Communication Center. We can share calls across the province, and we'll be looking for similar skill sets in our crisis workers, which we're in the process of onboarding.
Our final question for this morning comes from Alan Hale at Queen's Park today. Please go ahead.
Hi there. This is a question for the Solicitor General. I was wondering if you could give us your reaction to the announcement that Working Families is going to be challenging Bill 307 in court based on Section 3 of the Charter.
Thanks, Alan. Well, as you know, every Ontario citizen has the right to challenge their opinions in the Ontario court, so I will leave it to that process to continue its way through the court system. What I will tell you is when I explain to constituents that as individual members of the public, we have very strict limits on the maximum amount that we can donate to political parties, provincially and locally, and to suggest that there shouldn't be similar limits for organizations, businesses. They agree that there must be limits. There have to be boxes around what one individual or organization should be able to provide in terms of influencing a provincial or federal election, or municipal, frankly. Thank you.
Follow up?
Are you confident that this action will not be able to take down the bill as it's been passed?
I have full confidence in Attorney General Doug Downey, and I will let the courts do what the courts do best.